Now let's move on to the next oral presentations entitled Comparative Effectiveness of High Dose versus Standard Dose Influenza Vaccines in Elderly, a retrospective crossover cohort study at Nakornping Hospital, Thailand, presented by Thanittha Dusitakorn from Medical Education Center, Nakornping Hospital.
Good afternoon, everyone. My name is Thanittha Dusitakorn. Today, I will present my study on the relative effectiveness of a high-dose influenza vaccine versus standard dose influenza vaccine in elderly at Nakornping Hospital. First of all, influenza is a major global public health problem, especially in elderly because this group is immunosensed and higher risk of severe complications. According to WHO report, up to 600,000 deaths worldwide each year. In Thailand, during 2024, influenza is the second most common infection, and in elderly case, it increased by more 90%. So nowadays, high-dose influenza vaccines is developed to enhance the immune response in elderly. It is 4 times more antigen doses when compared with standard dose, and in previous international study showed high-dose influenza vaccine is superior effectiveness when compared with standard dose and no significant difference in adverse event. Nowadays in Thailand, there are no public study compare high-dose influenza vaccine and standard dose influenza vaccine, which lead to the study. The objective is to compare OPD and IPD rate due to influenza and respiratory illness adult age 65 years and older after receiving a high-dose influenza vaccine and standard dose influenza vaccine or no vaccination in the same individual. The study design is a retrospective crossover cohort study. We start with the elderly who received the high-dose influenza vaccine, including 630 individuals at Nakornping Hospital during 2024 to 2025. The 2 patients were excluded due to a short follow-up, and when we look back to the previous year, 139 individuals who has previously received the standard dose vaccine and 489 individuals who has never received the vaccine. And then we compare with the outcome during different periods. We focus on the OPD and IPD visit for influenza and respiratory illness. The data analysis is multi-level mixed effect Poisson regression and result as incidence rate ratio with 95% confidence interval. The result that is the baseline characteristic. The patient who the mean age is 71 years and the most common comorbidity is the hypertension. When we compare with the before and after receive high-dose influenza vaccines that show the influenza vaccine significantly reduce OPD visit rate for respiratory illness by about 54%, but in IPD and influenza vaccine, not different. And when we compare the high-dose influenza vaccine with the standard dose, that show high-dose influenza vaccines can reduce OPD visit rate by 63%. And when compared with no vaccine, high-dose influenza can reduce OPD visits by 47%. So this is the summary of the results. Show that high-dose influenza vaccines significantly reduce OPD visit rate for respiratory illness when compared to both. And by risk reduced 63% when compared standard dose, and risk reduced 48% when we compare no vaccination. So in the conclusion, the high-dose influenza vaccine demonstrates superior effectiveness in preventing OPD visit rate, but in IPD visits or an influenza infection, no significant difference due to insufficient power. And the last topic is the recommendation. We recommend to policy support access to high-dose influenza vaccine for elderly. Thank you for your attention.
Thank you for the excellent research. May I ask about how did you account for the differences of the influenza severity between each year, between season? That's one thing. And another thing is that the vaccine effectiveness each year, there are also difference. Because the influenza vaccine changed by year, by season, right? The component. And each year, the vaccine effectiveness may not be the same. Did you take those two factors into account about the seasonality and the vaccine effectiveness variation?
I think my study have a limitation because it's the time very change to variants of the influenza. So I think it's the co-founder for this study. Co-founder.
Yes, I'm really agree because in each year the influenza virus is maybe change the strain and change the pattern of infection. So maybe the last year they're not severe than this year, or maybe better than this year. So we cannot tell that your vaccine is effective than the last year. And my question is, you show that the patient who not receiving vaccine admit to the hospital because of the respiratory illness less than the patient who got the single dose vaccine. Why? How do you explain that?
I think it's the confoundation by indication, because the patient who received the standard dose in previous year that have more comorbidity or fragile than the no vaccination is the like a doctor decided to receive the standard dose for this group more than in the normal in the healthy. I think it's the confounder by indication.
When we use the higher dose, it should be to recall the side effect. Do you have the data of the side effect of the higher dose and the standard dose?
My study, this is the limitation of my study again, because it's in medical record in my hospital. They didn't the data about the adverse events of influenza. So I think it is the limitation of my study. But I researched previous international study I predict is the high dose influenza vaccine and standard influenza vaccine no significant difference in the adverse events.
Thank you very much.